Clinical research is how we get better. Ideally, it offers the patient the best of both worlds. It often will compare two types of treatment. The one type of treatment which might be considered best practice, best standard of care, cutting edge, state-of-the-art, versus a treatment that in theory we believe may be as good or even better.
The opportunity to participate in a clinical trial gives each patient involved in that trial the opportunity to have another form of treatment, as well as helping future cancer patients with their diagnosis and having the best treatments available to them.
Some of the current clinical trends in cancer research include looking at immunotherapy as well as prevention studies. Immunotherapy is where we take medications and activate a person's immune system to help fight against a cancer. In terms of prevention studies, it may be looking at attempts at weight loss through diet and exercise to help a patient to prevent the cancer from returning.
Name a disease site and we have something for you, whether it be breast, prostate, lung, head and neck, survivorship, quality of life. You can take your pick, and whatever you come to us with, almost certainly there will be something that you will be considered for clinical trial-wise that could have a very positive impact on your experience.
Throughout this clinical trial that I'm involved in for 1 year, I take just 2 simple pills every day and record that information and meet with my clinical trial nurse just every couple months, and she goes over all of the possible side effects and tracks how I'm feeling and doing on my clinical trial. So it's been very easy to do.
I wanted to try the study to, as it would say, pave a way for me as well as my family, because we do have a history of breast cancer, and just to be knowledgeable, more knowledgeable, and get more education about it so I can share it with my family as well as friends.
Within our cancer center, we have multidisciplinary conferences. At these conferences, many of the patients have been pre-screened for clinical trial enrollment, and our physicians, including surgeons, radiation doctors, and medical oncologists, all discuss whether a patient may benefit from enrollment on these trials.
Any treatment we're offering has had its birth through the clinical trial process. Clinical research is so very exciting to us because it allows us a mechanism to get better on a daily basis, to provide better surgery, to give better chemotherapy, to give more elegant radiation. It allows us to strive to be the best we can be, to push the envelope. That keeps things exciting when you're pushing yourself, when you're doing everything you can to offer the patient the best outcome we can achieve.
It is important for me as well as others to know their option, because knowledge is the key, and you want to always know what options you have to take regardless to what age or stage that you're in. And it's important to ask your doctor if options are available, including clinical trials.